name is Amy Tuzzolino, and I'm going to talk to you today about the leadership project and the interviews that took place over the past few weeks. I sat down with a few leaders in the community to ask them advice and questions that would help me in the future. Let's take a look. So what are the objectives of this leadership interviewing that took place? Well, one of them is to discover the different leadership styles, the differences and the similarities. And lastly, how does this apply to our practice as nurses? There were 3 interviews that took place: an interview with a nurse leader, an interview with a faith leader, and an interview with a business leader, all in the greater Houston area. So grab a cup of coffee, sit down with me, and let's listen to what they have to say. I sat down to have coffee and breakfast with Amanda Rees, who has her MBA and also her BSN in nursing. She was so incredibly busy that I felt very lucky to even grab a cup of coffee and breakfast with her before her meetings began. She has been in healthcare for about 25 years, but she has been a director for only a year and a half. But she brings with her to this company of Unity Care Health great leadership and a wealth of experience and knowledge. Amanda Rees is the Executive Director of the Unity Healthcare System. She is new to management with only about a year and a half of managerial experience. But that's what makes her unique, in that she understands how the employee thinks. And she's very approachable. She oversees operations across 3 different hospitals and also multiple outpatient centers. She is a very employee-centered director, and she focuses on strategic leadership, workforce development, quality improvement, and above all, patient-centered care. Providing patient-centered care in looking at the whole picture of the patient. It doesn't matter who they are or where they come from, Ms. Rees says. We have to provide the best care possible. Ms. Rees was asked, how would you describe your leadership style? She said, I practice transformational leadership. I believe in inspiring and empowering my team, rather than just directing them. My goal is to foster a culture of trust, innovation, and collaboration. She said, in today's healthcare environment, especially post-COVID, it's essential to be adaptable and people-focused. She regularly involves nurses at all levels in decision-making to ensure that their voices are heard. I asked Ms. Rees if she could give an example of how she applies this strategy, this style of leadership day to day. One way, she said, is through shared governance. We've established nurse-led councils that have real authority in clinical decision-making, policy updates, and practice changes. when we recently revamped our clinical documentation process using AI-assisted tools, nurses from different departments were a part of that planning, testing, and rollout. It improved buy-in and helped us to avoid pitfalls. Speaking of change, healthcare has seen rapid transformation, and I asked Ms. Rees how would she approach the organizational change. She said change management is a huge part of what I do. My approach is rooted in the Kotter 8-step change model, but it's adapted for modern healthcare. First, I build a strong coalition of nurse leaders, frontline staff, and interdisciplinary partners. Communication is critical. We focus on transparency, context, and continuous feedback. I also lean into data quite a bit. Nurses trust evidence, so presenting real-world evidence as outcomes helps to drive the adoption of new practice. In 2025, Amanda says, we're also facing significant shifts with digital health, workforce shortages, and equity. So we have to lead with empathy and great flexibility. For example, she said, when implementing our remote patient monitoring program, we piloted it with home health nurses first, gathered the feedback, and adjusted the training and scaled it up. It's all about iterative change and listening. Then I asked her, what is the biggest challenge for nurse leaders today? She said, retention and well-being. Those were the two main areas. Burnout is still, unfortunately, very real. Ms. Rees said that burnout is real. We've made big strides by offering more flexible scheduling, mental health support, and leadership pathways for young nurses, but the systemic support and recognition of nursing as a profession, just not a role, is the key to success. That's something I advocate for, Ms. Rees said, nationally, as a part of the American Association of Leadership Council. The final question I asked her was, what advice would you give upcoming nurse leaders? She strongly said, lead with a purpose and compassion. Don't underestimate the power of listening and learning from those around you. Stay informed, be tech savvy, she said, and never stop advocating for your team, for patients, and the future of nursing. In conclusion, let's look at the takeaways from Amanda Rees. Leadership in nursing today requires vision, empathy, and strategic agility. Transformational leadership builds resilient and empowered teams, especially in lieu of the COVID-19 pandemic. Nurses must be creative, and leaders must understand and be empathetic. Successful change comes from inclusion data and good communication. Nurse leaders shape not just their teams, but the future of healthcare in general. Jordan Mitchell, who is the CEO of Lone Star Logistics in Clear Lake, Texas, joined me for some questions about leadership. Jordan Mitchell is the CEO of Lone Star Logistics, which is a mid-sized logistics and warehousing company based in Clear Lake, Texas. We specialize in last-mile delivery and smart warehousing solutions across the Houston metro area. My role focuses on strategic direction, innovation, and making sure our team is empowered to deliver exceptional service in a rapidly evolving market, he said. Mr. Mitchell was asked, "What would you say defines your leadership style in 2025? He said, "I believe in leading from behind, supporting my team, removing roadblocks, and ensuring that they have the tools and autonomy to succeed. I would say my leadership style is a servant leadership with kind of a tech-forward mindset," he said. Mr. Jordan was asked a little bit more about the company. He said, "Lone Star Logistics is in Clear Lake, Texas, but it actually serves the greater Houston area." He emphasized on innovation, speed, and sustainability. He specializes in last mile delivery and very smart warehousing, he said. It's a mid-sized logistics company, and he oversees the strategic direction and operations, and he cares about empowering his employees. He drives the innovation in the tech adoption, and he said he's focused on building a high-performing and agile culture. Mr. Jordan said, "Practically speaking, I hold weekly round tables with team leads, not just to report numbers," he said, "but to listen. We also have what we call freedom frameworks, clear goals, but with the flexibility for each team to decide and determine how best to achieve those goals. Our use of predictive analytics and AI-based route optimization has been driven from the ground up, with employee input in every phase," he said. "I see my job as setting the vision and then getting out of the way." By having these weekly round tables and listening to feedback from the employees, it is all about the employees leading the initiatives. Leadership, in his opinion, is about giving the vision, the trust, but most importantly, he said, empowering the employee to take the initiative. Organizational change can be tough, especially in a fast-paced industry like yours. How do you approach it? I asked. "You're right," he said, "the pace of change in logistics is intense. My approach is what I call adaptive engagement. First we listen, then change starts with understanding the pulse of the workforce. Then we communicate early and often. It's not just about what's changing, but why. And finally," he said, "we phase change in. We don't do a big bang transformation. For example, when we transitioned to electric delivery vehicles, we started with just 5 vehicles as a pilot program, got the feedback, and then scaled it in gradually. This," he said, "builds trust amongst the employees and is better for a smoother adoption of the new plan." I asked Jordan Mitchell what his advice was for future leaders. "Be curious," he said. "Seek understanding, not just control. Balance people and data. Lead with service, but don't lead with ego. Embrace constant change." He said the future of leadership must be agile, inclusive, purpose-driven, data-formed, but above It is about your relationship with your employees. Pastor Michael Harris is the senior pastor of the NUR816 Church in Houston. We're a non-denominational congregation, he said, committed to community outreach, spiritual growth, and interfaith collaboration. Our mission, he said, is to serve as a beacon of hope and light, with unity in a diverse and rapidly changing city in Houston, Texas. Pastor Michael Harris was asked, "What would you say is the most significant aspect of your leadership style?" He said, "I would describe my leadership as relational and adaptive. In a city as diverse as Houston, it's crucial to connect with people where they are, emotionally, spiritually, and culturally." He said, "I prioritize active listening, empathy, and inclusivity. This approach helps to build trust and fosters a sense of belonging among our congregation and the broader community." Pastor Michael Harris is the lead pastor at the NUR816 Church in Houston, Texas. It is a very diverse non-denominational faith community, he said, and we try our best to focus on the spiritual growth and outreach and blend everything together. Sometimes a member of the church might know people and might bring them into the church. We want to reach everybody. I definitely actively listen and I build trust with my employees and the church. How do you approach organizational change? I asked, especially with all of these shifts that are rapidly occurring in society. The organizational change approach is collaborative and intentional. It's really led, he said, by a shared decision making. It's not just the leader, the pastor of the church. It involves the congregation and the staff. But first of all, you have to have an alignment. We have to make sure that the spiritual values and community needs line up. For example, we have a digital ministry and it's expanding for broader accessibility. We have community outreach programs, wellness programs. We focus on mental health, financial literacy, and family support. We also conduct community needs assessments, and we have professional workshops as well for our employees. In light of recent events such as the legal challenges that have been faced by your church, how do you navigate governance and transparency, I asked, within your organization? He said, governance and transparency are the foundations of our ministry, and we do maintain clear communication channels and involve our congregation in key decisions throughout regular town hall meetings and open forums. This participatory approach, he said, helps to prevent misunderstandings in the community and the congregation and ensures that our leadership remains accountable to those that we serve. He said that these are very important aspects of maintaining an honest church. In looking ahead, what do you envision for the future of your faith leadership in Houston? He said, I see a future where faith communities are even more blended into the fabric of civic life. With that, I mean by collaborating with local governments, schools, and other organizations, we can address systemic issues such as poverty, education, and healthcare blended more efficiently. Faith leaders have a special role, he said, a very unique role in advocating for justice and compassion. And I believe that Houston's diverse religious communities will continue to be a very powerful force in advocating for a positive change. And as I mentioned before, he said, I want to see people bringing in more to our congregation. I want to see people that know other people, friends of friends, spreading the word about our church, and therefore building our congregation. That's very important, he said, for the survival of our church here in Houston, Texas. These 3 leadership interviews in conclusion highlight the inclusive and adaptive leadership nature across healthcare, faith, and business sectors. Dr. Rees in nursing uses transformational leadership and evidence-based strategies to empower nurses, and she also believes in the 8-step Kotler's model. Pastor Harris practices relationship building and emphasizes empathy and cultural awareness. That's very important. And lastly, Mr. Mitchell, who is a business owner, applies servant leadership and has a tech-forward approach. And he believes in fostering innovation in his workforce development. All 3 emphasize stakeholder engagement, shared decision-making, and values-driven change, leading to trust, resilience, and a meaningful impact on their respective fields. How can this help me in my nurse practitioner role? Leadership insights from the interviews can greatly enhance my practice. Dr. Rees' transformational leadership and use of evidence-based practice supports team empowerment and improved patient care. Mr. Harris's relationship bonding leadership style and his cultural awareness is so important to practice. And lastly, Mr. Mitchell's servant leadership and his ability to foster AI and innovation is also vital to moving forward into the future, especially as we become more tech savvy. So all 3 of these highlight the importance of stakeholder engagement, shared decision making, and values-driven change. And applying these 3 principles to my practice will foster perseverance, resilience, meaningful impact, and they also align with the advanced nursing practice's holistic and collaborative nature. Thank you so much for joining me today.